Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. MRI is famous for joint imaging, but ultrasound has a unique superpower: real-time dynamic movement. Today, we are exploring musculoskeletal ultrasound. We will explain what patients experience during joint scans while breaking down high-frequency transducer physics, anisotropy artifacts, and power Doppler for our technologist community. For patients, an MSK ultrasound is completely painless, safe, and interactive. Unlike scans where you must lie completely still inside a tube, an ultrasound allows you to talk directly with your technologist and point out exactly where it hurts. The technologist glides a small probe with warm gel over your joint to look at muscles, tendons, and ligaments in action. One of the biggest advantages of MSK ultrasound is dynamic testing. Some joint issues, like a snapping tendon or nerve impingement, only happen when you move your arm or bend your ankle. During an ultrasound, your technologist can scan your joint while you move it, catching functional problems that still pictures might completely miss. For our sonographers and student community, image quality in MSK ultrasound relies heavily on transducer selection. Superficial structures like the Achilles tendon or wrist ligaments require broadband, high-frequency linear array transducers operating between 12 and 18 MHz to maximize axial and lateral resolution. Deeper structures, such as the hip joint, require lower frequencies to achieve adequate beam penetration at the expense of fine spatial resolution. Evaluating tendon pathology requires a firm grasp of normal sonographic architecture. In a longitudinal plane, healthy tendons exhibit a hyperechoic fibrillar pattern, appearing as bright parallel uniform lines representing collagen fascicles. In a transverse cross-section, tendons display a honeycomb or cobblestone appearance. Interruptions in this continuous pattern indicate fluid tendinopathy or partial to full thickness tears. One of the most common pitfalls in MSK ultrasound is anisotropy. Because tendon collagen fibers are tightly structured, sound waves reflect back to the transducer only when the sound beam strikes the tendon at a perpendicular 90-degree angle. If the beam hits at an oblique angle, reflected sound waves bounce away, making the healthy tendon appear artificially dark and mimicking a tear. Tilting the transducer restores perpendicular alignment and eliminates this artifact. Evaluating active inflammation in tendons and joint linings benefits greatly from power Doppler. Unlike standard color Doppler, which displays flow direction and mean velocity, power Doppler measures the total amplitude of the Doppler signal. This makes it angle independent and far more sensitive to low-velocity microvascular blood flow, helping technologists detect subtle neovascularization in tendinopathy and active arthritis. Sonographers also play a key role in identifying peripheral nerve entrapments like carpal tunnel syndrome. On cross-sectional views, nerves present a distinct honeycomb appearance with dark hypoechoic nerve fascicles surrounded by bright connective tissue. By measuring the cross-sectional area of the median nerve at the wrist, technologists can provide quantitative evidence of nerve swelling and compression. Beyond diagnostic imaging, MSK ultrasound provides real-time guidance for interventional procedures. Clinicians can track a needle in real time as it enters a joint capsule, fluid collection, or tendon sheath. This ensures medication is delivered with pinpoint accuracy, making treatment more effective and far more comfortable for the patient. Musculoskeletal ultrasound combines real-time motion testing and high-resolution sound waves to evaluate joint health safely and dynamically. Thanks for watching. If you learned something today, make sure to like, comment, and subscribe. And check out our merch store for more cool medical imaging items.